Evidence has shown that there is an upsurge of refractive error at the onset of teenage years. Vision-related problems affect school-age children, and that can impair their education performance and also cognition and learning, resulting in reduced enrollment and increased absenteeism.
Examples of software.
It is in the light of this that Brien Holden Vision Institute, in collaboration with the Universal Basic Education Board of the Education Secretariat, Federal Capital Territory, Abuja, decided to carry out a study. In the light of this, it became necessary to state and find out amongst our children the magnitude of refractive error, and at the same time, how do we define what best suits our own setting. In Nigeria, we have found out that 5 to 8% of children have uncorrected refractive error. For every 100 children, 5 to 8 of them have impaired vision and unable to study, because 70% of learning is through vision, and that is why it's important that every child be given that opportunity. Currently, we have sporadic school eye health screenings that go on through NGOs, professional bodies, and so only a few children actually benefit from these. We want a situation where every child in school has that opportunity, and that may be the only opportunity that that child has for a proper eye examination. A study design was put together to compare two models. What we are doing now, which is the standalone model, and then to see how we can integrate the eye component into the school health that already exists. Training the eye nurse in such a way that the eye nurse can identify some minor eye conditions, and that proved to be beneficial and effective at the end of the day. We have found that if a school nurse is trained to identify minor eye conditions, and the school teachers are trained to screen the students in their classrooms, then we will have effective way of identifying the eye problem, more effective way of referrals, and also uptake of service. Why do I say so? We found out that more children with eye problems were identified in the integrated model than in the standalone model. We also found out that more children received spectacle correction and retained it after 5 months more than in the standalone model. And we also found out that there were other conditions beyond glasses that can affect their vision as well, could be picked up at the hospitals. So what we need to do is to carry this research forward. We found out that the cost for eye health per child was less than 700 naira in the integrated model, but that amount was nearly 3 times in the standalone model. And if glasses are to be provided, we also found out that it was cheaper in the integrated model than in the standalone model. So we hope that government can carry this forward. If it is integrated into our school health policies, then even that amount will be less, because more children will come into the system, and in all, collectively, I believe that it will even come down to 100 naira per child.